This is the Superhuman Channel, doing reps with the weight of the world. The following paid program does not necessarily reflect the views or opinions of the staff and management of Triceptor Productions or the Superhuman Channel. Triceptor Productions and the Superhuman Channel are not responsible for any claims, warranties, or guarantees made during this program. Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host,
It's Monday, the beginning of a new week, and as such, we're kicking the week off with an amazing show. During the first hour, I'll be joined by Dr. Terry Wahls to talk about her new book, The Wahls Protocol, which addresses how to beat progressive multiple sclerosis using paleo principles and functional medicine. Very, very proud to say that Dr. Terry Wahls is on the show with us today. How are you, Dr. Wahls?
Excellent. Very glad to be here.
Talk about your history, first of all. You are a physician, correct?
Yes. Board certified internal medicine, a professor of medicine at the University of Iowa.
And you were diagnosed with MS, correct?
Diagnosed in 2000 on the basis of a history of optic neuritis and then a new problem with my left leg. I had lesions in my spinal cord and abnormal spinal fluid.
Okay. Now, as a physician, I have to think, did you feel like you were empowered, that you could get the right information, or were you relegated to dealing with other physicians who just summarily said, this is what you do, go away now?
Well, I knew that within 10 years, a third would have difficulty walking, needed a cane, walker, or wheelchair, and one half will be unable to work due to severe fatigue. I was the main breadwinner for our family. I had 2 young children. So I sought out the best MS center I could find, which was the Cleveland Clinic, saw their best people. They said, yes, you have MS. I took the newest drugs, including Tizabri, the miracle drug, but continued to steadily decline. And that's when I decided I needed to start investigating things on my own and started reading the scientific literature myself.
Now, the physicians at the Cleveland Clinic, which is a wonderful facility, the physicians at the Cleveland Clinic, when you started to go off on your own and start doing research, and especially when you started to look at nutrition as a possible adjunct to dealing with this disease, were the physicians complimentary and say, hey, do whatever you have to do, or were they like, no, don't waste your time?
Actually, my physicians at the Cleveland Clinic got me started on looking at nutrition. They introduced me to Dr. Lauren Cordain
Sure.
and the Paleo diet. So I started that after 20 years of being a vegetarian. I switched to the Paleo diet, reintroduced meat in 2002, but continued to decline. 2003, I needed the wheelchair, and I went back to reading the mouse studies, adding some vitamins and supplements that appeared to slow the speed of my decline. In 2007, I discovered Jeff Bland's work in the Institute for Functional Medicine, had a much longer list of nutrients that I was taking by pill form, and then I realized I should get this from the food. And so I reorganized how I ate to stress the foods that contained these 19 nutrients that I was tracking. And that's when the magic really began to happen.
Now, when you say you were vegetarian, were you like a lacto, ovo vegetarian, pesha vegetarian?
I was eating cheese. I ate dairy. I ate eggs. Okay. And I had lots of vegetables. So I had what everybody would consider to be a terrific diet.
Right. Okay, so then you discovered these 19 nutrients that you started tracking. Are these nutrients that theoretically should be present in our diet but just aren't because of commercial food production? Or are these nutrients that are somewhat exotic and elusive and we have to work hard to have them in our diet?
I think you need to pay attention, and that's why I've organized my diet the way that I have. But most people, because they eat so few vegetables and have foods that are highly processed and are actually very low in vitamin, mineral, and antioxidant content, I would say most Americans are probably very low on these nutrients.
Okay. Let's talk about multiple sclerosis for a second. It seems to be occurring in greater and greater numbers in our population, and it seems to also be somewhat gender biased. More women seem to develop MS than men. Am I correct on that statistic, or did I get that wrong?
It's 80% women. There's been, I believe, a 500% increase over the last decade. And I think that's in part due to the declining status of the nutrition and the increasing level of toxins to which we are exposed.
There's even some recent research that shows that synthetic progesterone or progestins, progestin-only birth control pills, depending on how long a woman takes them for, increases the likelihood of developing MS. Have you seen those studies by any chance?
I have not. Although, today on NPR there was a blurb about the studies using estriol, the form of estrogen that goes up during pregnancy, is very helpful.
Interesting.
So that may be a new development that people will be talking about in the coming years.
Typically when a woman develops multiple sclerosis and then undergoes, and maybe it doesn't have the ability or the wherewithal or even the perseverance to seek out a facility like the Cleveland Clinic, goes to whatever facility is available in her area, they are relegated to pharmaceutical methods of treating or dealing with the disease, right?
Correct. I would say it's the very rare neurologist that will talk to people about the quality of the diet, physical activity, stress reduction, or toxin exposure. Very sad, but very few physicians think about the environmental factors that are really responsible for 95% of the risk for developing MS and for how severe the disease will be.
And when I had a sister who succumbed to Parkinson's disease, and I know that the drugs that used to what's the word I'm looking for? To mediate the symptoms or manage the symptoms tend to progress the disease somewhat faster. Is this true of MS too? Do the drugs that they use maybe even progress the disease faster?
I hesitate to say that, but they don't get at the underlying root cause of what's causing the body to have this abnormal immune response. And because they don't get at the root cause, the time to wheelchair, time to leaving work has not been changed by these disease-modifying drugs.
Now, you say the root cause. Can we identify? Is there one root cause, or is this sort of a perfect storm like we see with? Yeah. But but do they all lead to, for instance, inflammation that causes neuronal decay, or do they all? Is there anything that we can point to?
There are two big problems occurring with MS. One is excessive inflammation, and the other is deterioration and death of the brain cells too early. And the disease-modifying drugs can block the inflammation, but the disease-modifying drugs do not change the deterioration and early death of the brain cells. And so the many leading scientists are now saying that the reason people end up with early departure from work and in the wheelchair is because of the deterioration and early death of brain cells and spinal cord cells.
Now, before we go into the break, one other statistic that I think is worth noting is that women typically develop MS either at peri or post-menopause. Is that correct?
No, that is not correct.
Okay, so correct me.
So,
good.
I'll correct you. Usually people have symptoms for 1 or 2 decades before diagnosis. The most common age of diagnosis was in the 40s. that is getting younger. We now see people being diagnosed as in their teens. I think the youngest that I'm aware of is age 6.
Oh, my gosh.
So the age of onset is much earlier. Men will be diagnosed also in their 30s and 40s. They have a more severe progressive form.
And MS is not one of those diseases that's simply diagnosed based on symptoms. They can actually detect the lesions that form in the body, on the brain, and other nerve bundles, correct?
Correct. The way that's usually done is through a magnetic resonance imaging or the MRIs, and they can see white lesions, hyper-intense lesions in the spinal cord and in the brain. And I also want to stress to your listeners that the Wahls protocol is very effective for all types of autoimmunity: rheumatoid arthritis, lupus, scleroderma, hidradenitis suppurativa, asthma, eczema, psoriasis. And it's also very effective for Parkinson's disease.
Yeah, and because all of these diseases share a common thread in the fact that the immune system begins to attack the body in one way or another. We're going to take a quick commercial break. When we come back, we're going to pick it up on the other side with Dr. Wahls. We're going to talk a little bit about where she is now, and then we're going to talk about how what she learned in curing herself is now contributing to those out there who are suffering from the disease and looking for alternatives that actually work.
Your radio just got ripped. It's Superhuman Radio.
Welcome back to Superhuman Radio. We're talking with Dr. Terry Wahls. We're talking about her new book, The Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine. So let's talk about you for a second. So where are you today after employing the protocol, and how long did you have to employ the protocol to see results?
So within 3 months, my fatigue was gone. And I no longer needed Provigil, the drug I'd taken for 5 years for MS fatigue. Within 6 months, I was walking throughout the hospital, and my physician allowed me to taper and then stop my disease-modifying drugs. At 9 months, I got on my bike for the first time in 5 years. At 12 months, I did an 18-mile bicycle tour with my family. The following year, I did a trail ride with my family in the Canadian Rockies. Then the following year, I started doing clinical research, testing this protocol and others with progressive MS. And last weekend, I jogged around the block with my kids for more than a mile.
That's
I think
pretty
about
impressive.
a mile and a quarter that we did. Now, for my kids, it was a very brisk walk. For me, it's a slow jog. It's thrilling. And I can see that probably within the year, I'll be up to jogging 2 miles. And then I can start working on improving my speed.
Now, talk about briefly some of the other people that you did some of your research with. Did they see similar results?
So, we do have another individual who is able to jog, lift weights, go to Pilates. She's doing 5 and 6 mile hikes with friends, family, and her dogs. And in our clinical trial, we see about a third, and these are all people with progressive MS. You expect no spontaneous remissions. These are people who the best you can hope for is to slow the decline. So we have a third who have clinically very meaningful improvements in their walking ability, a third who have slight to moderate improvements, and a third who still decline. However, fatigue, the elimination of fatigue really happened for everyone, with the exception of the person who had developed leukemia as a side effect of her chemotherapy that she had taken years earlier. So the reduction in fatigue appears to be really quite remarkable, as does the improvement in thinking, mental clarity. In my clinics, where I see traumatic brain injury and extensive mental health problems, we see, again, dramatic improvement. In my other clinic, which is for what we call the therapeutic lifestyle clinic, people with complex chronic health problems, often many diagnoses, often multiple autoimmune problems, when we get them on the Wahls protocol, their energy improves, pain goes down, mood improves, and the need for their medicine steadily decline, and we're able to gradually taper and get them off medicine after medicine. That's why whatever health problems you have, getting your cells better nutrition and helping your bodies more effectively process and eliminate toxins will likely result in better energy, less pain, and less need for medication.
What about the lesions? Does the body have the ability to reabsorb the lesions?
So, that in progressive MS, those lesions have been there for a long time. I'm not sure that they're going to regress. We did obtain pre and post MRIs, and that data is being analyzed now, so I can't really comment yet.
Okay.
There are papers that are out there with case reports of people who have had food sensitivities, had a lot of lesions in the brain, that by removing those food-sensitive issues, the lesions have healed. You'll see that most often in people who are early in their disease, early in the relapsing, remitting, where you can expect to see regression. Late in the disease, in the progressive phase of disease, I think that's going to be less likely. Although we clearly are changing the rules because people are getting better. Their gait's improving. They're getting back to walking, jogging, etc. So even if the MRI does or does not change, the brain is clearly plastic enough that it can rewire around it.
Yes. And we see, because the only reason I ask that is because we know that individuals who suffer from rheumatoid arthritis, after just a few years of eating a paleo diet, training greater levels of activity, the body actually reabsorbs a lot of those proud joints. They start to shrink. And so I was just curious if the body has the ability to kind of maybe through some sort of metabolic debris repositioning process, get rid of all of that, the lesions.
I expect that may well be the case. Physiologically, we anticipate it takes 7 to 10 years to replace the cells in the brain. It's a long process.
Yeah.
So if one did MRIs at the baseline and in 10 years, would those lesions be gone by then? I think that's really quite possible. And so when I've had follow-up MRIs, my lesions were still there. But that was several years ago, and I'm now jogging. So my health continues to improve. And if we, gave me another 3-4 years and obtained another MRI, would those lesions be entirely gone? I think it's quite possible. We won't know. And if I continue to improve, there'll be no clinical rationale for getting an MRI to validate that observation.
What's the source or the pathway for the fatigue? Is it mitochondrial dysfunction?
Well, there's a huge debate. What is the biochemical source for the fatigue? Science doesn't know what that is yet. I think it's probably inflammatory cytokines in the brain, driven by poor diet, toxin loads, perhaps chronic infection issues, and certainly what I see in my clinics, fatigue is probably the number one complaint that people have in my traumatic brain injury clinic, my therapeutic lifestyle clinic, and in my clinical trials. And when I put people on the Wahls protocol diet, fatigue is the first thing that people report being improved. Mental clarity is the second thing that's reported to be improved. Then probably the third thing for people who have pain, pain starts reducing as well. And that's across basically all of the diagnostic problems that I see in my lifestyle clinic, in the TBI clinic, and in my clinical trials.
Do we know how long well, I guess we know that depression may be caused by inflammation and not vice versa. We know that if someone has inflammation, the body sees this low level state, and wants to fix it. And the way the body fixes it, it says, look, we need to rest so that the immune system and all resources could be used to heal. But the healing never gets better, so the body never wants to stop resting. So is it possible, as you point out, that the inflammatory response in the brain is responding by saying, hey, we need to lay down more, we need to rest more, something is wrong, we don't want to expend energy, we want to use all of our energy for repairing ourselves?
It's an interesting theory. That is a very interesting theory. We certainly know that increased inflammation is very much a driver in depressive states. And the fatigue that people experience is probably central or brain in origin. And I agree with you that my thinking is it's also really compromises our mitochondria. And if the mitochondria can't generate enough energy in the brain, then you're going to experience really quite profound fatigue.
Right.
And even people with severe heart failure, when I put them on the protocol, their fatigue improves and their ejection fractions improve.
Do you think does the this is something I've been thinking a lot about lately, like mitochondrial biogenesis. What is the life cycle for mitochondrial turnover? And is that required to see changes in energy levels, or is it simply uncluttering and unclogging the mitochondria of metabolic waste that it doesn't need to deal with? So,
the mitochondria need, in order to work well, they need a terrific supply of B vitamins, a terrific supply of minerals. They'll need a bunch of antioxidants. They're also going to need, because the mitochondria are cell membranes, and all the activity works on proteins embedded in those membranes. So then you need to have omega-3, omega-6 fat, saturated fat, and cholesterol to maintain healthy membranes. So there's a lot of very intense nutrition that's required. In addition, you have to protect the mitochondria from lead, mercury, arsenic, pesticides.
Good luck.
It's chronic antibiotics, all of which all of us have in our bodies. So we designed our nutrition protocol to be sure that you are giving the mitochondria all the building blocks they need to do the work, and that the protocol is designed to help the body eliminate these toxins that are poisoning the mitochondria. And because we see the fatigue being, in some people, they see huge changes in their energy level as fast as 2 weeks. Sometimes it'll take up to 12 weeks. But that's an incredibly quick turnaround.
Yes.
There are very few drugs that will act that quickly, other than an antibiotic for an infection, to resolve the symptom that you're trying to treat.
No, I agree. I want to take a quick commercial break. When we come back, I want to stay with this just for a moment longer, about mitochondrial function for a moment. I want to talk about, I'm going to put a lightning rod out there. Nobody likes to talk about taking their alcohol away. I'm wondering if women who have MS self-medicate, do doctors say, hey, a glass of wine, okay? They told my sister with Parkinson's, yeah, a glass of wine a day is okay. I disagree with that. I want to see where you stand on the whole alcohol debate. We're talking with Dr. Terry Wahls. This is an amazing book. Multiple sclerosis is one of those diseases that there are very few answers for women. It's one of those diseases that I hate to say this, but women are always relegated to the, it's in your head, or there's nothing we can do about it and you just have to live with it, type of scenarios with a lot of these diseases that come back to a common denominator, which is autoimmune, in nature. Fibromyalgia is another one of those. A lot of doctors will tell their female patients, have a glass of wine. It takes the edge off and it's good for you. And I've done a lot of research in alcohol, especially on how it compromises the mitochondria. What is your position on alcohol, Dr. Wahls?
So alcohol is a neurotoxin. And so people with traumatic brain injury, neurodegeneration, they're certainly better off avoiding alcohol. However, I also acknowledge that in studies of alcohol use, people who take no alcohol have a slightly higher risk of chronic disease and all-cause mortality than those who have an occasional use of alcohol. So I do note that an occasional glass of wine once or twice a week may be beneficial. It may be less toxic. Can certainly make a very good case for zero alcohol. Daily alcohol, you can make an excellent case, is harmful.
Yeah. I you know what? I know that there's studies out there. Recently they did a study on, I think, centenarians, and they said the one thing they all had in common was they drank a shot every day or a glass of wine every day. And my response to that is, well, then everybody who drinks a shot or a glass of wine every day should live to be 100, but that's not the case. There's a lot of people who die at 50, 60, and 70 who have a drink every day. So that's one of those epidemiological mishaps, in my opinion, that sends the wrong message. And I always come back to, when a boat is sinking, they say women and children first, right? So I say if alcohol's so good for you, then pediatricians should be telling us to give them to our babies. If it's that good for you, start giving it to them when they're 6 months old, because it's going to protect them even more. And that's nonsense. We know that's a rhetorical statement. We would never give a baby alcohol. So why do we feel, because we're formed already, that it's good for us? And keep in mind, Dr. Wahls, I enjoy wine. So when I say this, I say this for my own benefit as well. I like the buzz I get from wine, but I don't kid myself and say, well, it's going to help me too.
No. I mean, so in my book, I give people levels to that. There's level 1, level 2, level 3. When they get to level 3, the advice is you can have the alcohol for those very special occasions. Your son is getting married. You're going to toast the new groom and bride. Yes, go ahead and have a glass of wine for those special occasions. But this should not be a regular use. Thank you.
Okay. All right. So now let's talk a little bit about the book itself. So when people buy this book, can they actually just follow the book exclusively? Do they need to work with their doctor as well?
Well, I always recommend that, first off, when you do this kind of intervention, you do it together as a family. And I do recommend that you talk to your physician to identify, are there issues that cause this have to be personalized? For example, taking Coumadin, you're going to have to work with your doc in terms of how you increase your vegetable intake. Or if you happen to have kidney stones, there may be some modifications of the diet that are necessary, or the person who has diabetes. And certainly as you implement this protocol and your body begins to heal, the medication needs will decline. And so you'll be needing to work with your doc to wean and taper off the medications. For example, for me, when my fatigue resolved, I couldn't sleep at night. And after a week of being up all night, I called my neurologist. He goes, okay, we have to stop the Provigil keeping you awake.
Yeah.
So I do think it's important that you tell your doc. And probably the best person to work with is the primary care physicians, because the primary care docs are the ones that'll be most excited when you say, look, I want to be eating, 9 cups of vegetables every day. And I want to be exercising, and I want to switch to organic foods. Your primary care doc should be thrilled with that and be glad to help you navigate this change and help you navigate these gradual tapering of medicines as you begin to heal.
Talking about the diet for a second, the statement I'm going to make, or the question I'm going to pose now, is more for the uninitiated, because I know firsthand that the dietary recommendations in this book can beget amazing health across broad areas of people with diseases very successfully. When you are talking to the medical orthodoxy about your book, do you ever have to caution yourself about saying, well, this will work for rheumatoid arthritis, this will work for fibromyalgia? Because all of a sudden then they're going to go, oh, wait a minute. How could this work for everything? Because they're so used to everything being a vertical segment. Well, this is for this disease. And it almost becomes like, okay, you know what? We can't take this seriously. She's saying it's going to work for everything. And you and I know it does, because 99% of the disease out there is caused by the diet, but they don't get that.
Well, but they get biochemistry, they get cellular physiology. So when I give my lectures, we review the cellular physiology, the nutritional changes in the standard American diet, then in the diets that we're advocating, and I review how that physiology has changed. And then I show our results, including the compliance data that we have, the change in fatigue scores, medical symptoms questionnaire scores, and then I show my amazing videos of where people were at their walking ability when they enrolled, and where they're at with their walking ability as they progress through their protocol. And you see people, start jogging and jumping again. It's breathtaking. So whenever I've presented to scientific meetings, or now I'm going around the country giving research seminars, physicians are very excited about our findings. And even the rheumatology groups are intrigued by what I'm showing, and we're certainly changing minds. Absolutely.
You say your Beijing group. This was done in Beijing, China?
No. This was done in Hong Kong, China.
Okay.
It was over and, showed my results. I had a lovely conversation about the observations there.
Okay. Gotcha. Okay. We talk a lot about diet, but we're learning more and more that inactivity is tied to so many diseases. In fact, inactivity is a greater predictor of risk for cardiovascular disease than anything else, that diabetes status or anything else. In the case of individuals with MS, obviously motor coordination becomes an issue.
Yes.
Is it one of those, you got to prime the pump things? Like you need to you need to keep being active, whatever that means. If standing more is your only level of activity, then stand more.
So, certainly what things that I'm observing is, fatigue and, mental clarity, can be helped by diet. Changing, walking ability is going to require physical therapy and physical training, so you can rebuild muscle mass, rebuild the coordination, and so engaging in physical therapy. And I discuss this in the book. I give people exercises with great illustrations that they can begin, but I also vigorously encourage asking for a physical therapy consult so they could be personally assessed for what muscles are weak, what are their problems, and have an exercise program designed specifically to address those issues.
One of the things I wish that those who are involved in medicine and science would pick up on, and it's hard because we're all looked at, one of the things that I've been preaching for 10 years on the show is the techniques used by bodybuilders. And the reason I say that is because building one's body is a science. Eating the way you need to eat, training the way you need to train, resting the way you need to rest, doing all the things that allows the body to increase muscle, which is seen as a metabolic deficit. And from the standpoint, I take that back. It's a metabolic luxury. Because it's very, very costly calorically. You have to do a lot of things to get the body to go, okay, we'll add another pound of muscle. We think we're safe doing that. And I've often wondered why the medical orthodoxy, when they come to these types of discussions, building muscle increases neuronal adaptations, central and peripheral nervous system adaptations, as well as skeletal muscle adaptations, everything changes. I have to believe that a modified bodybuilding protocol would benefit an individual once the fatigue has been mitigated by the diet, once the energy levels are starting to come back and they're able to move. I have to believe that resistance training will recollateralize the nervous system, make new inroads into muscles that will compensate for maybe inroads that have been lost through the disease. I have to believe that a bodybuilding protocol could benefit these individuals if we could just unlock from the aesthetic, bodybuilder, drug user, meathead kind of stereotype.
In my exercise chapter, I do talk a great deal about resistance training and interval training, and I could not agree more. I think resistance training is a very beneficial way of training. and should be an important part of everyone's daily routine.
Yeah, I agree 100%. Let's do this. Let's take our last commercial break. We'll be right back with more of Dr. Terry Wahls.
Jumping higher, left and more. It's Superhuman Radio.
Welcome back. We're talking with Dr. Terry Wahls. We're talking about her new book, The Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine. This is a fantastic book for anybody who has an autoimmune disorder. I tell you that up front. It doesn't have to be MS. The book is focusing on MS because that is the disease that Dr. Wahls was challenged herself by. So I made a note here to myself, vegetarian. How much of a role do you think being a vegetarian, and for how long were you a vegetarian, did that play in maybe nutrient deficiencies that exposed you to developing this disorder?
So I was vegetarian almost 20 years. And it probably depleted my vitamin B12 stores in that, I didn't know that I should be supplementing with B12. I didn't realize that a vegetarian diet does not provide sufficient B12. So that was certainly part of it. I think I probably did not have a good omega-3, omega-6 fat ratio. I had too many carbs, and I probably had a dysbiosis with too many sugar-loving and carbohydrate-loving bacteria
Microbes.
and yeast in my bowels.
Yeah.
I'd shifted my microbiome. So there were many factors for me that contributed to why I got into problems, and that was probably part of the problem.
What about grains? Do you have any opinions on grains, good, bad, and different?
Yes. For the genetically susceptible person, consuming gluten-containing grains will increase leaky gut, increase inflammation, and contribute to the development of an inflamed, disease-prone body and autoimmunity. Not everyone is genetically predisposed, but maybe 20 to 35% of people from North African and European descent carry the DQ2, DQ8 alleles that make you at risk for developing gluten sensitivity.
Interesting. Now, gluten is a lectin. It's a protein. It's classified as a lectin, but there's got to be other lectins that are designed to be anti-nutrients in order for grain seeds to protect themselves.
Right. So they are in legumes and in grain seeds. So I recommend restricting those from the diet. Although I do make an entry-level diet that lets people still have legumes and gluten-free grains at a reduced level. As they progress through the diet, then I have them soak and sprout those grains for at least 24 hours. That'll reduce those lectins, reduce those anti-nutrients. And then when you go on to the third level diet, you take all that grain and legumes entirely out.
Now, but my point is there have to be other lectins that pose dangers to the body. Gluten is the lectin du jour, but there's got to be other ones. And the other thing that I want to mention here is if you're eating eggs from quote unquote vegetarian chickens that are eating soy and corn, you're getting lectins, you're getting gluten in the eggs. If you're drinking dairy that are coming from cows that are eating grains, you're getting lectins, you're getting gluten in that milk too.
Well, the milk has casein in it, and casein has an amino acid sequence that mirrors the amino acid sequences in gluten. So 80% of those who are gluten sensitive will also be casein sensitive.
And it doesn't matter if it's A1 or A2 beta casein?
It does not matter.
Okay. All right.
So my recommendation is to not have dairy. You can have clarified butter, in which the milk proteins have been removed, and people will tolerate that.
Mm-hmm.
But I give pretty strong recommendations to remove gluten, remove casein, and to remove eggs. And then I also talk about soy, peanuts, nightshades as potential problems.
Right.
But, I try to make this as easy as possible for people to begin. So the first level diet, we just take out the worst problems. And then as you progress through the diet, you can be more thoughtful about whether or not you want to take out the soy, legumes, all legumes, and the nightshades as well.
Interesting. And nightshades include tomatoes, don't they?
Yeah, they include tomatoes, eggplants, peppers, and potatoes. And the book talks about how to take things out and then reintroduce them to sort out, are these foods a problem for you?
Are there any ways to neutralize them? You know, we know fermentation and soaking things. Is there any way to make tomatoes safer to eat or eggplant safer to eat?
I don't know of a way to do that. Fermentation might. I don't know. Certainly for the legumes and seeds, soaking is helpful. And I predict fermentation would be helpful. But if there's any question, you take the food out, and then you can retest. And one way to retest, of course, would be to ferment the food.
Yeah.
Potatoes, there's probably nothing that you can do if you're sensitive. Take them out.
Your website is Terry Wahls, WAHLS.com. You're going to be in Ohio. Is that right? Did you say Cleveland?
No, actually, Illinois. I'll be down in Chicago at the Naperville Anderson's Bookshop on Thursday evening, doing a presentation, Q&A, and signing books. It'll be a wonderful, wonderful event.
The Wahls
the last event I was at, we had 600 people at. So check it out and get there early, so you'll be for sure having a spot.
The Wahls Protocol is the book. It's available at superhumanradio.com or where finer books are sold. It's really a great book. It's a great book not only if you have MS and you're looking for a way to live a healthy, thriving life again, but if you have any autoimmune disease, fibromyalgia, rheumatoid arthritis, the principles in this book are universally usable by anyone who has any autoimmune disorder out there today. It's a fantastic opportunity for you to regain your life, as you did, Dr. Wahls. I mean, Dr. Wahls, did you ever think when you were first diagnosed that you would have found a way to be better? No. I had completely accepted that this was a progressive disease. I realized I was probably going to become bedridden and demented. And when I began this protocol, my simple goal was to slow the progression, hopefully stop it. I had no idea I was going to get better. In fact, I had to be remarkably better. I was walking around the neighborhood before I began to consider that this might be sustainable, and I might be able to get back close to normal given enough time. It took a long time for me to risk having hope. Interesting. Yeah, because you didn't want to be let down, obviously.
Yeah.
Learn what 19 nutrients are critical in your diet. Learn how to eat the right way again. You know, if I had a nickel for every person who says, I eat healthy, I would be a wealthy person and wouldn't need to do this radio show. Those same people have disease, they're diabetic, they're obese. Eating healthy means nothing in this day and age. It means nothing. We have lost our instinct on how to eat. It's been bred out of us through the industrialization process. You can learn how to eat again and how to live again. Healthy, thriving life. The Wahls Protocol. Pick it up at superhumanradio.com. Dr. Wahls, thank you so much for being on the show today.
Thank you. It's a pleasure.
Take care.